Dr. Price, is it true that 90% of skin cancer is caused by not just sun exposure, but tanning beds?
Absolutely.
Tell me a little bit about what causes the skin cancer.
Well, what happens is the ultraviolet rays, the UVB and UVA rays from the sun, enter the skin and they cause damage to the DNA of the cells of the skin. Our body tries to repair that damage, but unfortunately we're not able to repair it all. So that it creates mutations or abnormalities in those cells, which cause them to multiply abnormally and create skin cancers. Those rays also enter deep into the dermis of our skin and damage our collagen and elastin. And we all know what that does.
No, that's no bueno. So where on your body do you normally see skin cancer? When your patients come in, what is the most common area?
I think the most common areas are all sun-exposed areas. We see a lot of skin cancer on the face, but it depends on your activities, but we mostly see it on areas of sun exposure. However, we can also see skin cancers on areas that are not exposed to the sun, but most of the skin cancers are on sun-exposed areas.
Now, on those non-exposed sun areas that see the sun, how do you get cancer in those areas?
I think, I think some people have a genetic propensity to get to cancer, and they can get it in those areas as well. And we see this, we can see skin cancer underneath a nail, we can see it on the bottom of the feet, and we can see it developing in people that have abnormal moles on their skin.
When I go for my skin cancer checkup,
right.
You know, you check the scalp,
Correct.
You check under the feet, like
Correct.
you said. She's looking through my fingers.
Good.
All areas, these cannot be neglected, correct?
Absolutely. Any part of the skin can develop skin cancer. So I think it's important whenever you see something abnormal or see something new and different or symptomatic in any area, you should immediately get it evaluated.